Professional Services Incorporated PSI versus AGANA, GR number 126297, January 31, 2007. Facts: Natividad AGANA was rushed to the Medical City General Hospital because of difficulty of bowel movement and bloody anal discharge. After a series of medical examinations, Dr. Miguel Ampil diagnosed her to be suffering from cancer of the sigmoid. Dr. Ampil, assisted by the medical staff of the Medical City Hospital, performed an anterior resection surgery on Natividad. He found that the malignancy in her sigmoid area had spread on her left ovary, necessitating the removal of certain portions of it. Thus, Dr. Ampil obtained the consent of Natividad's husband, Enrique Agana, to permit Dr. Juan Fuentes, respondent in GR number 126467, to perform hysterectomy on her. Thereafter, Dr. Ampil took over, completed the operation, and closed the incision. However, based on the record of the hospital, the attending nurses indicated, nota bene, that 2 sponges were missing. The same was reported to Dr. Ampil but were not found after diligent search. After a couple of days, Natividad complained of excruciating pain in her anal region. She consulted both Dr. Ampil and Dr. Fuentes about it. They told her that the pain was the natural consequence of the surgery. Dr. Ampil then recommended that she consult an oncologist to examine the cancerous nodes, which were not removed during the operation. Natividad went to the United States for 4 months, but she was only declared free of cancer later on. In Natividad's return to the Philippines, her daughter found a piece of gauze protruding from her vagina. Upon being informed about it, Dr. Ampil proceeded to her house where he managed to extract by hand a piece of gauze measuring 1.5 inches in width. He then assured her that the pains would soon vanish, but instead, the pains intensified, prompting Natividad to seek treatment at the Polymedic General Hospital. While confined there, Dr. Ramon Gutierrez detected the presence of another foreign object in her vagina, a foul-smelling gauze measuring 1.5 inches in width, which badly infected her vaginal vault. A rectovaginal fistula had formed in her reproductive organs, which forced stool to excrete through her vagina. Natividad underwent another surgical operation to remedy the damage. Civil and administrative complaints for damages and gross negligence respectively were filed against Professional Services Incorporated, the owner of Medical City Hospital, Dr. Ampil, and Dr. Fuentes. Are the following liable? So this is the issues. Is Professional Services Incorporated liable based on employer-employee relationship, doctrine of apparent authority, and corporate negligence? Is Dr. Ampil liable for medical negligence and also liable under the captain of the ship doctrine? Now, is Dr. Fuentes also liable under the doctrine of res ipsa loquitor? Held. Is Professional Services Incorporated liable based on employer-employee relationship? The answer is yes. Private hospitals hire, fire, and exercise real control over their attending and visiting consultant staff. While consultants are not technically employees, the control exercised, the hiring, and the right to terminate consultants all fulfill the important hallmarks of an employer-employee relationship, with the exception of the payment of wages. In assessing whether such a relationship in fact exists, the control test is determining. Accordingly, on the basis of the foregoing, we rule that for the purpose of allocating responsibility in medical negligence cases, an employer-employee relationship in effect exists between hospitals and their attending and visiting physicians. Is Professional Services liable based on doctrine of apparent authority? The answer is yes. Apparent authority, or what is sometimes referred to as holding out theory or doctrine of ostensible agency or agency by estoppel, has its origin from the law of agency. It imposes liability not as the result of the reality of a contractual relationship, but rather because of the actions of a principal or an employer in somehow misleading the public into believing that the relationship or the authority exists. In this case, PSI publicly displays in the lobby of the medical city the names and specializations of the physicians associated or accredited by it, including those of Dr. Ampil and Dr. Fuentes. We concur with the CA's conclusion that it is now stopped from passing all the blame to the physicians whose names it proudly paraded in the public directory, leading the public to believe that it vouched for their skill and competence. Indeed, PSI's act is tantamount to holding out to the public that Medical City Hospital, through its accredited physicians, offer quality healthcare services. By accrediting Dr. Ampil and Dr. Fuentes and publicly advertising their qualifications, the hospital created the impression that they were its agents, authorized to perform medical or surgical services for its patients. As expected, these patients, Natividad being one of them, accepted the services on the reasonable belief that such were being rendered by the hospital or its employees, agents, or servants. Is professional services liable based on corporate negligence? Now, the answer is yes. Hospitals' corporate negligence extends to permitting a physician known to be incompetent to practice at the hospital. A patient who enters a hospital does so with the reasonable expectation that it will attempt to cure him. The hospital accordingly has the duty to make a reasonable effort to monitor and oversee the treatment prescribed and administered by the physicians practicing in its premises. In the present case, it was duly established that PSI operates the Medical City Hospital for the purpose and under the concept of providing comprehensive medical services to the public. Accordingly, it has the duty to exercise reasonable care to protect from harm all patients admitted into its facility for medical treatment. Unfortunately, PSI failed to perform such duty. Is Dr. Ampil liable for medical negligence? Now, the answer is yes. This is a clear case of medical malpractice, or more appropriately, medical negligence. To successfully pursue this kind of case, a patient must only prove that a healthcare provider either failed to do something which a reasonably prudent healthcare provider would have done, or that he did something that a reasonably prudent provider would not have done, and that failure or action caused injury to the patient. Simply put, the elements are duty, breach, injury, and proximate causation. Dr. Ampil, as the lead surgeon, had the duty to remove all foreign objects, such as gauzes, from Natividad's body before closure of the incision. When he failed to do so, it was his duty to inform Natividad about it. Dr. Ampil breached both duties. Such breach caused injury to Natividad, necessitating her further examination by American doctors and another surgery. That Dr. Ampil's negligence is the proximate causation or proximate cause of Natividad's injury could be traced from his act of closing the incision despite the information given by the attending nurses that 2 pieces of gauze were still missing. That they were later on extracted from Natividad's vagina established the causal link between Dr. Ampil's negligence and the injury, and what further aggravated such injury was his deliberate concealment of the missing gauzes from the knowledge of Natividad and her family. Is Dr. Ampil liable under the captain of the ship doctrine? Now, the answer is yes. Under the captain of the ship rule, the operating surgeon is the person in complete charge of the surgery room and all personnel connected with the operation. Their duty is to obey his orders. As stated before, Dr. Ampil was the lead surgeon. In other words, he was the captain of the ship. That he discharged such role is evident from his following conduct: calling Dr. Fuentes to perform a hysterectomy, examining the work of Dr. Fuentes and finding it in order, granting Dr. Fuentes permission to leave, and ordering the closure of the incision. To our mind, It was this act of ordering the closure of the incision, notwithstanding that 2 pieces of gauze remained unaccounted for, that caused injury to Natividad's body. Clearly, the control and management of the thing which caused the injury was in the hands of Dr. Ampil, not Dr. Fuentes. The requisites for the applicability now, is Dr. Fuentes liable under the doctrine of res ipsa loquitor? Now the answer is no. The requisites for the applicability of the doctrine of res ipsa loquitor are: first, the concurrence of an injury; second, the thing which caused the injury was under the control and management of the defendant; third, the concurrence was such that in the ordinary course of things would not have happened if those who had control or management used proper care; and fourth, the absence of explanation by the defendant. Of the foregoing requisites, the most instrumental is the control and management of the thing which caused the injury. Now, we find the element of control and management of the thing which caused the injury to be wanting. Hence, the doctrine of res ipsa loquitur will not lie. Okay? So it was duly established that Dr. Ampil was the lead surgeon during the operation of Natividad. He requested the assistance of Dr. Fuentes only to perform hysterectomy when he, Dr. Ampil, found that the malignancy in her sigmoid area had spread to her ovary. Dr. Fuentes performed the surgery and thereafter reported and showed his work to Dr. Ampil. The latter examined it and, finding everything to be in order, allowed Dr. Fuentes to leave the operating room. Dr. Ampil then resumed operating on Natividad. He was about to finish the procedure when the attending nurses informed him that 2 pieces of gauze were missing. A diligent search was conducted, but the misplaced gauzes were not found. Dr. Ampil then directed that the incision be closed. During the entire period, Dr. Fuentes was no longer in the operating room and had in fact left the hospital. So that's why Dr. Fuentes is not liable. So that's all for today. Please be sure to like, share, and subscribe to this page, and be sure to click the notification bell for further videos. Thanks for watching.